Hi all, welcome to today's session. Let's discuss about today's topic, that is emergency and progesterone contraception. Okay, this is very a clinically relevant topic because contraception is not only about preventing pregnancy but also giving women control over their reproductive health. So in our practice, uh, patients often come with concerns like, doctor, I had unprotected intercourse yesterday, so what should I do? Or I'm breastfeeding, can I still use contraception safely? So understanding these methods, their mechanism, indications, side effects, and how to counsel the patient is very important for both OPD and IPD settings. So let's move forward with today's topic. So let's have a brief intro of today's session. Contraception, as you know, it prevents the unintended pregnancy. So there are two major scenarios in emergency contraception and the progesterone contraception. So emergency contraception is used after unprotected intercourse. Think of it like a rescue method. Progesterone contraception is used for long-term prevention, especially in the woman who cannot take estrogen. So, in today's lecture, we will divide our discussion into these two parts. First, we'll understand the emergency contraception, its types and its limitations. Then, we'll discuss the progesterone-based contraception, which is a very practical choice for many patients. Okay, so let's move forward with emergency contraceptions. So, emergency contraception is like any method used after unprotected sexual intercourse to prevent pregnancy. So, the important thing to remember is it acts before implantation. So, if implantation has already occurred, it will not work. So, that's why timing is very critical. Most methods are effective only if used within 72 to 120 hours. So the earlier it is taken, the more effective it will be. So that is the emergency contraception. It used after unprotected sexual activity. It prevents pregnancy before implantation, and it should be or must be taken within a defined time window. So that is the emergency contraception. Next is the indications of emergency contraception. When whenever when we should be using the emergency contraceptions. When do we use this emergency contraception? The most common is after the unprotected intercourse. The condom rupture, that is the first point. Second is when the condom rupture or slippage is like another frequent complaint in the OPD. Third is the missed oral contraceptive pills. Like if a woman misses two or more pills, she may need an emergency cover. And in cases of sexual assault, when no contraception was used, then emergency contraception is very essential. So these are all the like very practical real world situation you will encounter in the OPD level. Okay. So this is the indications, so where we have to use the emergency contraceptions. Moving on to the type of emergency contraceptives. So there are different types of emergency contraceptives. So it also comes in different forms. Okay, first one is levonorgestrel. Levonorgestrel pill. So it should be taken within 72 hours, but earlier is better. Second is ulipristal acetate. So it is very effective up to 120 hours. So that's like around 5 days. That is a second type of emergency contraceptive. Third is combined estrogen progesterone, like CO, combined oral contraceptives, kind of like that. Combined estrogen progesterone, that is a USP method. You can say USP method. It uses combined thing like estrogen plus progesterone. It is less commonly used now due to the side effects, but it is the one of the emergency contraceptives. Fourth is copper IUD. So copper IUD, it is like an like a device, like we will be inserting it. So most effective if inserted within the 5 days, and it not only does it prevent the current pregnancy but also provides contraception for up to 10 years. So copper IUD is very most effective emergency type of emergency contraceptives. Okay, I guess you got a. You can see the picture below there, so you'll come to know the types of emergency contraceptives. Next is the mechanism of action. So how emergency contraceptions are working. So what are the like actions? So these methods work by multiple mechanisms. So the most important is delaying or inhibiting ovulation. So if ovulation does not occur, fertilization will not happen. So the most important is here, the mechanism of action here is inhibiting ovulation or delaying ovulation. Second is the alteration of cervical mucus. So the cervical mucus become thick here, which will prevent the sperm entry. Third is alter the endometrium. So finally, they alter the endometrium, making it less receptive to implant. So it will alter the endometrium layer. So they are a preventive, not abortive. So that is very important to explain to patient. So whenever when you are prescribing emergency contraception, it's better to counsel the patient regarding how, or like how it works on them, what are the actions of them before before advising the emergency contraception. So it's very important to explain these things to the patients. Next is the side effects of emergency contraceptives. So, what are the side effects of emergency contraceptives? First one is nausea and vomiting, irregular bleeding, headache, dizziness, breast tenderness. So, most women tolerate emergency contraception very well, but side effects may occur, like as I've mentioned here, especially when I have mentioned that use B method, that a combined estrogen progestin method. Now it's less commonly used, that USB method. In USB method, when you're especially in the USB method, the patient may have a side effect of nausea and vomiting, and as I've mentioned, irregular bleeding for few days, and there are few patients who will have a headache and dizziness and breast tenderness. So these are the side effects, and these will be mild side effects and self-limiting. So as I've mentioned, you should be educating the patient regarding the use of emergency contraceptives, their side effects also. So patient should be reassured about all these side effects also. So this is what the emergency side effects of emergency contraceptives. Okay, so now I think you got a picture regarding the emergency contraceptives, what it is, what are the types of emergency contraceptives, what are their actions of emergency contraceptives, and how, what are the side effects also. So now we'll move on to the next type of contraception, that is the progesterone contraception. Talking about the progesterone contraception, in the name itself you can know it uses progestin hormone only. It is very extremely important. Why? Because not all women can take estrogen. So for example, lactating mothers or those with the history of thrombosis, migraine or hypertension, in these cases the patient will not be able to take the progesterone hormone, the estrogen hormone. So in that cases you can advise progesterone contraception, which contains only progestin. So progestin methods are safe and effective, and they are available in multiple forms. Like you can get progesterone contraception in injectables, pills, implants, and IUDs and all, intrauterine devices and all. So that is the important thing about the progesterone contraception. Moving on to the types of progesterone contraception. So there are different types of contraception. Let's look at the types. First one is mini pill. So progestin only pills, POPs. We'll call POPs or mini pills, that must be taken at the same time every day. So even a delay of 3 hours can reduce the effectiveness. So If you're taking at for example, if the patient is taking at 1 o'clock, you should be next day also at the same time the patient will be taking. So every day taken, it should be taken at the same time. So if there is any delay of 3 hours and all, the effectiveness will be reduced. So that is the progestin only pills, mini pills, which contain only the progestin. Next is the injectable DMPA. DMPA stands for depot metroxyprogesterone acetate. So depot medroxyprogesterone acetate given every 3 months. So every 3 months can be injected. There is the injectable type of progesterone contraception. Third is the implants, subdermal implants. There are subdermal rods that are available that releases progestin slowly over 3 to 5 years. So it etonogestrel, levonorgestrel and all. The subdermal implant is kind of a rod you can implant inside the like subdermally. So it releases progestin slowly over to 3 to 5 years. That is one kind of types of progesterone contraception. Next is the levonorgestrel intrauterine system, LNGIUS. So it is like an intrauterine system releasing levonorgestrel. It gives contraception, and as well as it also reduce heavy menstrual bleeding also. So this is the levonorgestrel IUS. So these are the 4 types of progesterone contraception. Progestin only pills, that is POP or mini pill we can call. Then injectables like DMPA. Then subdermal implants are available, like a subdermal implant rods are available. Then LNGIUGs, that is levonorgestrel intrauterine system. So this is the types of contraception. Moving on to the mechanism of action, progesterone contraception mechanism. What is the actions going on? So these methods act mainly by as like same like an emergency contraception. It suppresses the ovulation. Although the mini pill doesn't always block it completely, it will help to suppress the ovulation. In case of mini pill, not always. Other things, it's always suppresses the ovulation, and it thickens the cervical mucus, to prevent the penetration of sperm, and the thinning of the endometrium. So it prevents implantation. So when the endometrium is thin, there will be no implantation. It becomes unlikely. And so this combination makes the progesterone only methods very reliable. So you can see the picture down there, the contraceptives and all. So this is the how the progesterone contraception act in the body when it is taken. So what are the advantages of progesterone contraception? It is safe in it can be safely used in breastfeeding mothers. They are suitable for women with the risk of blood clots like thrombosis and all, unlike the estrogen pills. And long acting actions are there, like options like implants or injectables reduce the need for daily compliance. So instead of taking daily, you can go for the injectables and implants, which will be have the effect for a longer period of time. Then except injectables, most are rapidly reversible. Fertility will return quickly after the discontinuation. So except injectables, others are reversible. So this is the advantages of progesterone contraception. Moving on to the disadvantages and side effects of the progesterone contraception. Not only advantages, but there are always a disadvantage too. It can lead to sometimes irregular bleeding or spotting. It's very common, amenorrhea. And some women complain of weight gain, bloating, then mood swings or headaches and all. Then with injectables like DMPA, that is the, as I've mentioned, the injectable DMPA, depot medroxyprogesterone acetate. So in that cases, like with the injectables like DMPA, fertility may take 6 to 12 months to return after stopping. So as I've mentioned, unlike the injectables, others are reversible. So injectables will take time for the fertility to come back, reverse it. So 6 to 12 months is required for the fertility to return after stopping the injectable. So this is side effect, and there will be headaches, mood changes and all. So that is also disadvantage and side effects of this case. And progesterone contraception. So proper before administrating or advising progesterone contraceptions, so always proper counseling is very essential before starting these any kind of methods. So in the OPD and all, you should properly counsel the patient regarding the side effects and usages and all. So this is the side effects of progesterone and progesterone and emergency contraception. Next is the clinical approach. Clinical approach, OPD versus IPD. Uh, so we'll know how we can manage these in the OPD basis and the IPD management. So coming to the OPD, like OPD basis, in our OPD we focus on counseling. Our focus is mainly on counseling. So we should explain the patients on the correct use of emergency and progesterone contraception, and is their side effects and their usages. Most women can be managed here, and prescribe appropriate pills or injectables based on their history. So we should be always taking the medical history of the patient before administrating it. So prescribing it, so prescribe appropriate pill or injectable based on their medical history, and always, as I've mentioned, discuss the side effects and complaints. Coming to the IPD management, IPD admissions are rarely needed, and it may be required if there are complications such as excessive bleeding or severe reaction and all, then as allergic reactions or any other acute events. In those cases, IPD management is required. Otherwise, no need. Only when the cases of complications you can do. And manage the complications and stabilize the patient in the IPD management, and shift to long-term contraception after stabilization. So after once you stabilize the patient, assess the condition, stabilize the patient, manage the complication, you can always shift to a long-term contraceptions. So in those cases, we, like I've mentioned, those cases we should stabilize the patient and later switch them to a safer longer term method. So this is how you can approach the patient in the IPD. So these are the two ways you can approach the patient clinically in OPD basis and IPD basis. So to summarize today's topic, emergency contraception and progesterone contraception. So those are contraception which is used to prevent unintended pregnancies. Emergency contraception is like a short term post intercourse solution that you can do as an emergency contraception. When talking about the progesterone contraception, it is like a long term. So it's the only method which is used for long term use, especially in the women who cannot take estrogen. So progesterone contraceptions are like a estrogen free option. So those women who cannot able to take estrogen, you can go always for a progesterone contraception, and before prescribing always take the medical history. And as I've mentioned, both methods are safe and effective only when it used appropriately. So before taking it or prescribing or advising it, take the medical history, and based on their history only, then if it is required, then you can advise the, it can be pills or injectables and all. So always counsel the patients regarding their side effects and how to use it, and what are the action, what will be happening to the body after taking it. So all these things you have to mention it and reassure the patient regarding the contraceptions. And clinical emphasis, first one is correct the choice. Patient counseling is very important. OPD focus, mainly majority of the cases will come in OPD basis only, unless and until any other complication cases arise. Otherwise all these cases usually comes under the OPD basis. So remember, effective contraception improves the woman's health. So reduces the, and effective contraception reduces the unintended pregnancies, and it is very useful in the when it comes to family planning also to. So that is the session for today. I hope you understood the topic today we have discussed. So that's the end of today's session. Thank you so much for patient listening. Have a great day.